Hey, future nurses. Today we're diving into the assessment phase. Listen, this is the very first and most important step in the nursing process. You cannot afford to forget this. Have you ever wondered how nurses seem to know exactly what's going on with their patients? It all starts with a solid assessment, gathering the right information, spotting key clues, and setting the stage for top notch patient care. We're going to be talking about the assessment, so I want you to grab your pen and your notebooks, hit that like and subscribe button, please, and let's break down the art and science of nursing assessment in a fun, simple, and easy to remember manner. Let's do this. Get ready to level up your nursing game. Listen, by the end of this video, you're going to be a pro at the various types of nursing assessments and why they even matter. You're going to be able to crack the code on how nursing and medical assessment works together and how to master the difference between objective versus subjective data. Should be no confusion on those two right there. Also, you're going to learn how to gather and organize patient information like a boss and be able to tackle data collection challenges. And additionally, you're going to be able to stay on top of the privacy and documentation rules. We're going to also dive into the must-know interview techniques and when to validate and report crucial patient details. So stick around. In a fun, practical way, we're going to unpack everything you need to ace your nursing assessments. Let's get at it. Assessing involves the continuous collection, analysis, validation, and communication of patient data to understand their health status and their needs. This process helps nurses develop comprehensive care plans by gathering relevant information from the patient, family, medical records, and other professionals. The initial assessment establishes baseline data for making judgment about the patient's health and care needs, while ongoing assessment tracks changes in the patient's condition. Accurate and systematic data collection is essential for ensuring safety, efficiency, and proper care. Nurses also verify questionable data and communicate findings to other healthcare providers to support effective treatment. The nursing process relies on accurate initial and ongoing assessments. This requires strong critical thinking and clinical judgment. Now, the key task in assessment includes using frameworks to identify nursing and medical concerns and evaluating the credibility of those information collected, while also recognizing normal versus abnormal findings. It's important for nurses to assess the significance of the data that they collected and distinguish between relevant from irrelevant detail. It's also important to identify any biases that the nurse may have, any inconsistencies noted, and be able to identify any information that's missing during data collection. Now, ensuring the accuracy and reliability of the data is essential for effective care planning as well. Do you want to think like a professional nurse? Then listen up. Nursing assessments aren't just about collecting data. They're the secret sauce to sharp clinical reasoning. Every assessment, every data that you collect, it has to be on point. That means it must be purposeful, it has to be prioritized, your data collection has to be complete, and it also has to be systematic. Whether it's a comprehensive checkup, a focused exam, or an emergency response, or even a follow-up assessment, knowing what to look for first is key. Now, to avoid missing crucial details, assessments should be organized and fact-based. You hear me? Fact-based. It gotta be factual, okay? Because accuracy saves lives. Plus, recording everything clearly and consistently keeps the whole healthcare team in sync. So let's break it down and turn you into an assessment expert. All right, future nurses, it's time to put on your detective hat. Assessing. What is it really? It's like solving a mystery. You're gathering clues, you're making connections, and you're uncovering the full story of your patient's health. Let's break it down. First, you want to begin by prepping yourself. This is where you start to dig in. You're going to collect the facts because every detail matters. You're going to spot the clues because this is where you're going to ask yourself, what's really going on here? Once you've done this, then you're going to go and double check your findings because, like we mentioned earlier, accuracy is key. You're going to connect the dots in which you are going to find patterns and make sense of it all. This is where you're going to make it make sense, okay? After you've done this, now you're going to share your story. In sharing your story, we mean by you're going to record and report like a pro. Once you've done all these steps, you will be an assessment expert in no time. Let me tell you guys something. First impressions matter, believe it or not, even in nursing, okay? The initial assessment kicks off right after a patient arrives into your facility, whether it be like in a doctor's office or in a hospital setting. You got to set the stage for their care journey. Think of it as if you're laying the foundations for everything that follows. Listen, you got to think of what your mission is. Your mission is to gather all the key details. Ask questions like, what the heck is going on? What needs urgent attention like right now? And how do I plan ahead? This is the first deep dive that helps you set your priorities, and you better know how to manage your priorities, okay? Also, in addition to all of that, you got to track your progress and make sure that your patient gets the best care possible. It's like you gathering all the patient's health snapshot and you making sure you getting it right. Period. Okay, let's talk nursing assessment. First of all, there are various types of nursing assessments, and each of those types have their unique purpose. The first one we're going to talk about is the focused assessment. Now, imagine a patient comes in with chest pain. Bruh, you are not going to check their toenails first, right? Because that just doesn't make sense. You know what I mean? Instead, you'll ask the right questions like, when did it first start? What makes it worse? What treatments have you tried? You can even ask them to point directly where is the pain. This type of assessment helps uncover new or overlooked issues, and it can be used during the initial checkup or that can be used during routine follow-up. Okay? Let's talk about emergency assessments. With emergency assessment, every single second counts. Okay? Let's picture this. You're on your shift, and suddenly, that's when a patient starts choking in the diner hall, someone rushes in with a stab wound, a patient becomes unresponsive, and a visitor starts acting aggressively. This is where your nursing instinct should start to kick in. Now, what's your job during this situation? Your job is to assess and assess fast, and you need to focus on what matters the most, which includes clearing airways, stopping bleeding, checking for vital signs, and preventing harm. Now, in an emergency, there's no time for second guessing, kid. No time for playing. You cannot self-doubt or doubt yourself. You gotta think, you gotta act, and you gotta save lives. Let's learn how to do so effectively. Number one, let me tell you something. When a patient is in serious danger, there's no time for hesitation. You jump right into action. Emergency assessments are all about speed, precision, and saving lives. That's it. Okay? Here's how it works. Number one, first you're going to identify the crises. Is it choking? Is it massive bleeding? Is it unresponsiveness? Or is it aggression? Okay, once you've identified the crisis, now you want to assess the most urgent problem and deal with it first. Airway, breathing, and circulation. Or is it immediate safety to threat? Threat to safety. Then you act fast and efficiently. You clear the airways, you control the bleeding, you stabilize the vital signs, and then you prevent harm. Now, whether you're handling a medical emergency or a mental health crisis, your role as a nurse is very crucial. It's very critical. You're the first line of defense between life and death, so there's no time for hesitation. Okay? Now, with time-lapse assessments, you're going to be tracking the patient's progress like a pro. Imagine being a detective, keeping a close eye on your patient's journey over time. That's exactly what a time-lapse assessment does. Instead of a one-time checkup, this assessment happens periodically to compare your patient's current condition with their baseline data from earlier or from when you first met them, right? Now, the question you may ask is, what type of patients benefit from this type of assessment? That would be patients who are in long-term care or even patients who are homebound and that's receiving ongoing nursing care. Does it really matter? Yeah, it does matter. Why does it matter? Because this reassessment is like a progress report for your patient's health. Okay? It helps nurses adjust the care plan based on improvements or new concerns. The best part is you get to see real results. Now let me give you a quick tip. A quick tip. A time-lapse assessment can be comprehensive, like a head to toe, or a focused, targeted to a specific issue type assessment. It all depends on what your patient needs because it's all about patient-centered care. Think of it as a before and after checkup because in nursing, progress is everything. Triage nurses, hey, these are the ultimate first responders in nursing. Let me tell you, imagine being the first line of defense in patient care, making split second decisions that could save lives. That's the power of a triage nurse, yo. Hey, what exactly do they do? Now, triage nurses, they're the ones that's assessing how serious the patient's condition is and they determine the right level of care and they do that quickly. Let's say, for example, a patient calls in with chest pain. This triage nurse, has to determine whether that chest pain is actually a heart attack or is it simply heartburn, okay, based on some assessment that they collected, right? Or let's say, for example, someone walks into the ER struggling to breathe. The nurse has to decide whether they need a doctor as soon as possible or ASAP. During the pandemic, triage nurses played a huge role in keeping patients safe, especially for high-risk individuals like cancer patients. Does it really matter? Duh, of course they matter. Triage nurses don't just collect symptoms. Nah, they make critical decisions. Their judgment and quick thinking can mean the difference between a simple doctor's visit and a life-saving intervention. If you love fast-paced, high-impact nursing, hey, triage nursing just might be your calling. All right, so here we have PCAM, or Patient Centered Assessment Method. I'm just going to call it PCAM for short. Now, PCAM is like seeing the whole picture, but not just only the symptoms. Let me tell you something. Healthcare isn't just about medicine, it's also about real life. That's where the Patient Centered Assessment Method, or PCAM, comes in. Now, listen. In short, simply put, instead of only focusing on the disease, PCAM helps providers look at the bigger picture, like a patient's lifestyle, their environment, and health knowledge. Because let's be for real now, people, managing diabetes is way harder if you can't afford healthy food or don't understand what your meds are, okay? So this is where PCAM is such a game changer. It helps healthcare providers spot challenges beyond just the medical condition. It also uncovers social and environmental barriers affecting the health of the client. In addition, it also guides providers to create better care plans that actually work for the patient. And you got to remember, each patient is treated individually. Now, by using PCAM, nurses and doctors can build stronger connection with the patients, tackle real life struggles, and make healthcare more personal, more effective, and more empowering. Before collecting data from a patient, nurses have to consider the type of information needed to create an effective care plan and avoid asking the same question repeatedly over and over again. Repetitive questioning can frustrate the patient and may seem like a lack of communication among healthcare providers. And let me tell you, patients get frustrated easily by that. Nurses spend different amount of times on various assessments depending on patients' needs, such as developmental stage, cultural background, and health concerns. Listen, the purpose of the assessment guides what information to prioritize and how much information you should be collecting. For example, assessing a child requires attention to their growth and behavior, while a patient recovering from surgery needs to be checked on their ability to care for themselves. Cultural factors such as language or beliefs should also be considered when collecting data. The type of data or information that a nurse collects depends on the patient's condition and the level of care required. Nurses should only gather information that is relevant to planning and providing quality care, avoiding unnecessary details unless they directly impact treatment. Let's talk about it. What's the difference between objective versus subjective data, and more importantly, what is that? So, there's two types of data, subjective data and objective data. Subjective data is basically personal experiences like what the patient is feeling. For example, pain or nausea. And this is only described by the patient. The patient themselves can describe what is going on, okay? Objective data is what's observed, what you can measure, such as temperature reading or visible symptoms. Okay, like the patient is actually grimacing. All right, this is what you, as the healthcare provider or as the nurse, can actually see. Okay, and it can be verified by subjective data are also called symptoms. All right, subjective is the symptom, what the patient is feeling, while objective data can also be called signs. This is what the healthcare provider can see. Listen, when it comes to the nursing assessment, you always resort to the patient first. That's your number one go-to source. Everything else is your secondary source, or everyone else is your secondary source. Primary source of information is always going to be the patient. But let's say if the patient is in pain, they're confused, they're too overwhelmed to communicate, this is when you're going to resort to secondary sources like family, loved ones. Of course, if the patient is awake alert oriented times 3, you're going to get the patient's permission to go to family, right? Now, remember, you can gather information from different resources like the medical records, past diagnosis, progress notes, lab results, treatments, etc., or the monitors and technology. That's why you're going to keep an eye on real-time vital signs and health trends. Other sources of information would be, of course, the other healthcare professionals, those you're collaborating with, because teamwork does make the dream work. So collaborating with doctors, therapists, and specialists for the full picture. And another source of information could also be the medical literature. Listen, if you need help on or you need an extra insight on what's going on with a medical diagnosis, researching specific conditions can help you make informed, evidence-based decisions. Bottom line, let me tell you, a great nurse doesn't just rely on one source. They piece together a patient story from multiple angles to deliver quality patient care. That's it. Let me tell you something. Nursing in and of itself is an art. And when it comes to collecting data, there is an art to it, okay? The art of nursing observation includes checking the patient's current physical and emotional state, looking at the patient's ability to manage their care, assessing the safety of the immediate surroundings. And as a nurse, you got to get into the habit of looking at the larger environment, like the hospital or the community. Now, when it comes to helping the patient, okay, or collecting data, let's look at, say it like this, when it comes to art, think of the word HELP, or the acronym HELP, okay, which is a mnemonic that helps you to understand when looking for early signs that the patient might be in some sort of distress and they may actually need help, okay, like a pale skin, or they're in pain, or they're having trouble breathing. So the H in HELP, just basically you want to look out for helping the patient, looking out for early signs. The E in HELP is environmental equipment, okay? You want to check for safety risk and make sure that the equipment is working, like, for example, the IV monitor, the oxygen, or a catheter. The L in HELP, you want to look. This is where you are observing. You are examining the patient carefully, making sure that the patient is not in any distress of sort. And then the P in HELP is people. The P stands for people. You want to identify who's in the room and understand what it is that's going on and what is it that they understand and what in the world are they doing in the first place. Okay, you as a nurse need to understand what's going on, who's there, and why are they there. Furthermore, there's methods of data collection. When it comes to data collection, You want to get into the habit of looking at the nursing history and physical assessments, which are important parts of collecting data. It can be written on separate tools or basically in one form, okay? When it comes to observation, it is very key in both steps where the nurses use their senses to gather information. Now, when it comes to the nursing history, it helps nurses to understand the patient's unique needs to provide personalized, select information, and followed by physical assessment. Key parts of the nursing history includes gathering their profile information, like their name, age, gender, ethnicity, marital status, their job, or even education. You want to know the reason for seeking care, like why is the patient here in the first place? Why does the patient need help? You want to know their health habits and their health needs, usual health patterns and communication. What else? The learning needs are all important information that you want to collect as it relates to knowing about their health habits. Cultural consideration. Nursing is about providing cultural competent care. So, in providing cultural competent care or considering their cultural background, you want to assess their diet, what it is that they do in terms of decision making, and what are their preferences for activities. You also want to collect information about their current and past health, which includes physical and any vaccinations. Their perceptions and coping mechanisms. You want to know how the patient views health and illness and what's their coping methods and what are their risk factors as it relates to coping mechanisms. Other information that you want to collect is family and social history, so the family background and environmental factors. You also want to know about their expectation and educational needs, in which you want to understand what the patient and family expects from care and how they can learn and participate. Let me say this again. You want to know what the patient and anyone else involved in the patient's care, what is it that they expect from care, all right? Got to know that. It's very important. The nursing history is collected through a structured interview with the patient. 4 steps. You're going to prepare for the interview where you're going to look at what information you already have on hand and what equipment that you're going to need to collect relevant information. You're going to introduce yourself. It's going to also include working with the patient on a continuous basis, and then also, like everything else, the conclusion of the relationship between the nurse and the patient. Good interviewing skills and empathy are key to building trust and gathering accurate information. You got to get into the habit, as great nurses that you are all destined to be, to collect data in an empathetic manner, and you got to have the right technique. You got to know how to communicate effectively with this patient and know what it is that you should and should not say. Physical exam or physical assessment. This is when a nurse examines a patient to collect objective information that helps understand their condition and plan the right care. This usually happens after taking the patient's history and interviewing the patient, either confirming or adding new details. Yes, while doctors usually do a full assessment, to diagnose conditions, nurses, on the other hand, they're going to focus on the patient's ability to function, like thinking, communicating, or doing daily tasks, especially if they have conditions like a stroke, for example. Nurses may use different methods depending on their setting, such as in intensive care units or in rehab. So the type of physical assessment or health assessment you conduct depends on the setting that you are in. Okay, listen. There's 4 main assessment techniques that you have to be familiar with. The first one being inspection. This is the very first thing that you're going to do anyway, which involves you carefully looking at the patient in an organized way. Palpation is another assessment technique which involves you touching the patient to check on things like the skin temperature, texture of the skin, moisture, vibrations in the body. Percussion is another assessment technique that you have to be familiar with, which involves you tapping on the body to make sound. Auscultation involves you listening to the sounds inside of the body with equipments like a stethoscope or a Doppler. Palpation and percussion, you gotta understand, is typically done by an advanced practitioner like a nurse practitioner or a physician, but you as a registered nurse has to be familiar with those techniques. Now, there's sometimes can be problems when you're collecting information or gathering data. Okay, some common problems in data collection includes disorganized data. Like you just poorly organized, you all over the place. That's a problem. Okay, your data should be structured and well organized. Okay, that helps you keep from or helps you avoid missing pertinent information. Problems include missing important information, including irrelevant or duplicate data, and misinterpreting or recording inaccurate data. That's going to be a huge problem. Other issues can involve not building a good relationship with the client in the first place. Like from jump, you already have a problem with the patient. That can poorly compromise the care of the client. Other issues can include recording interpretations instead of observed facts. In other words, you recording what you think or assume is happening instead of recording what actually happened. That's a huge problem and a big no-no. Okay. Other problems can be failing to update the database. Like there was a change an hour ago, but you didn't put it in, update that change, and that can compromise care. Some things you could do to fix this include reviewing the guidelines for specific or pertinent data. You may want to, for example, practice interviewing strategies. If you have irrelevant or duplicate data, like you repeated some information, maybe you want to determine the specific purpose of data collection for each of the patients you're taking care of and consider any existing data before even starting collecting data again. You may want to review and practice communication techniques. You may also want to identify the general data. So you could do a lot of things to help remedy or avoid making these mistakes when collecting data. Now, how are we going to confirm what we've observed? Nurses use cues and inferences basically to analyze data. Cues are pieces of information like, for example, the patient does not respond when I speak to him on his left side, while inferences are judgments made from those cues, such as the patient's hearing may be impaired on his left side. Does that make sense? So, to help you better understand, cues are the facts or signs you observe, like the high temperatures or the patient saying that they feel dizzy. This is what you've observed. And inferences is basically the conclusion you draw from those cues, like thinking the patient might have an infection because of the fever. To validate inferences, nurses can use physical exams, clarifying statements, they can consult with other team members, they can review research, they can also compare with normal functionings or check consistency of those cues that they've collected. Validation can happen during data collection or even afterwards, and once confirmed, the nurse needs to move on to analyze the data and develop a nursing diagnosis, which is a later step in the nursing process. Listen, as great nurses that each of you are destined to be, you need to know when to double check the data and ensure that it's on point, okay? Or when it's accurate, in other words. Validation is the process of confirming or verifying information to ensure that it is accurate. It's important to validate data when there's discrepancies, when the information just don't look right. So, for example, there's a discrepancy between what the patient says and what you as a nurse have observed, or when the data lacks objectivity. For example, let's say the patient say they feel fine, but their body language suggests otherwise, like they're grimacing or they're holding on to a body part, but yet they say they feel fine. So you gotta check that. As a great nurse, you gotta clarify that information because you gotta know what you're working with. Validation or validating data helps to ensure that the care is based on accurate information, and this helps prevent errors in nursing care. As great nurses, charting like a pro is very important, so every word should count. As soon as the patient walks through those doors, their story starts with you. So you need to be documenting like a right away. Enter the information into the system, or you complete the appropriate forms the same day to keep things smooth and organized. Are you missing any details? No problem. Just flag them so that they can be collected as soon as possible. Every note should be clear, every note should be complete and easy to understand. Listen, don't be writing with no messy handwriting either, okay? Because that's just not cool, okay? Don't write with confusing language. Just keep it simple. Stick to proper grammar and standard approved medical abbreviation for precision. Let me give you some pro tip. You want to make sure you organize your notes under clear headings so that they're easy to find later. And when charting symptoms, let the patient speak. What do I mean by that? So if you're going to write exactly what the patient wrote, then you need to use quotation marks. So, for example, if the patient said exactly, I feel tired from the moment I get up in the morning, I have no energy at all, then you want to use quotation marks. But if you're paraphrasing, then what you should do is just simply write, patient reports feeling short of breath when walking up one flight of stairs. Simple. Now, avoid the guessing game too. You need to avoid words like adequate, good, or normal because those are too vague. And what could be normal for one person may not be normal or good for another person. So be specific. When you're documenting a wound, don't say the wound is big or huge. No, say give the exact measurements of the wound. Okay? When you do this and you're precise, precision saves time, it prevents error, and it helps the entire healthcare team provide top notch care. Future nurses, let me tell you something. You are guardians of privacy. It's your duty to protect patient confidentiality like a pro. As a nurse, you're not just a caregiver, you're a trusted protector of patient privacy. Every single detail a patient shares with you is their story, their right, and their choice to keep confidential. They trust you to respect that. Now, are there families or loved ones in the room? Okay, before diving into an assessment, just pause. Either you ask the patient's family or loved ones to step out, or you get the patient's okay for them to stay. It's their privacy, it's their call. Now, you gotta stay sharp on the privacy laws. Make sure you review your book and you know also the facility's policies inside and out. And you cannot afford to forget about HIPAA. It's not just a guideline, it's the law. Now, I know we all hip on social media and nursing. Now, social media, listen, you got to handle that with care. According to the American Nurses Association and the National Council of the State Board of Nursing, both of them teamed up to create the must know guidelines for nurses who's navigating social media. I would encourage you to check out their website so you can gain expert advice on keeping your online presence professional and ethical. Okay? Because we gotta be demure, we gotta be professional, we gotta be ethical. Now, if you need more information, you can also look up the National Student Nurses Association, which also has statements on social media, the privacy, and how to maintain professionalism. Be sure to check them out. Now, the bottom line is you got to be able to protect patients' privacy, and it's not just a rule, it's an essential part of being a trusted, ethical, and professional nurse. Keep it confidential, keep it professional, and always keep it patient centered. Shout out to you because you made it through the essentials of nursing assessment. But listen, don't stop here. The real magic happens when you apply what you just learned in clinical practice and on these NCLEX questions. I left you a little bonus. It's something special just for you, and these are some NCLEX practice questions with the rationales. Won't you test your knowledge, strengthen your critical thinking, and boost your confidence for those exams? Don't forget to like, subscribe, and hit that bell so you never miss out on any nursing tips, tricks, and study gems. Drop a comment if you found this helpful or if you have any burning nursing questions. I'd love to hear from you. Get ready, go ahead and dive into those NCLEX practice questions. Thank you so much for watching this video on nursing assessment. Listen, your dedication to learning is what makes the nursing profession so impactful. If you found this video helpful, please give it a thumbs up, share it with your fellow classmates, other nursing students, and subscribe for more valuable content to support your journey. Together, let's keep growing and making a difference in patient care.